everyone, I'm Jacob Mirsky. I'm really happy to share an update on how our work at the Massachusetts General Hospital has been evolving and growing as it relates to lifestyle medicine. So today, I'm really honored to be here. Thank you for the invitation to Tyler and for all the support and spreading the word about what we're doing over in Boston. So this is just an overview of what I'm going to talk about today. On a high level, talk about the program that I'm the medical director for, the Healthy Lifestyle Program, give background and some objectives for our program, talk about the design of our program, outcome measures that we're looking at, some recent findings as far as how things have evolved, challenges and limitations, and also implications for lifestyle medicine practice. So the Healthy Lifestyle Program itself sits within the Division of General Internal Medicine. I'm an internist and primary care physician. And about 3 years ago, I helped to start this program with a few like-minded folks at Massachusetts General Hospital in primary care. Initially, it was just internists. We have expanded. We now have almost 50 members, including primary care physicians, nurse practitioners, health and wellness coaches, and nutritionists. Our mission is to empower people to engage in healthy lifestyles by integrating clinical practice, education, research, and community programs. And our vision, how we really try to do this on a day-to-day basis, is to establish the practice of healthy lifestyle as the standard of care for the prevention and treatment of chronic disease. The foundation of our program at this point is virtual group visits. When we started, we didn't really have a clinical offering. We didn't really have a direction that we knew we were moving in. But as our program has evolved, and certainly with the rise of virtual care during the COVID-19 pandemic, we've really identified that virtual group visits are the foundation for our work. So what I'll present today is mostly on the virtual group visits. But just to mention, we now have 4 health and wellness coaches in our program, just going around the horn here, starting at the top. So we have 4 health and wellness coaches. We're integrating remote monitoring of weight, blood pressure, and blood sugar levels into our virtual group visit programming. I'm also the medical director for the MGH Revere Food Pantry, which is a plant-based food pantry that will soon be integrated into the rest of our clinical programming. At the food pantry, we're actually about to break ground on a teaching kitchen next month, and that will be incorporated into the work that we do. We offer free virtual exercise classes for all of our patients, and we're in the process of building up lifestyle medicine videos as well. The virtual group visits themselves were the result of a transition from in-person group visits, which 3 years ago, about 5 of us were running in-person shared medical appointments or group visits. With COVID, we've developed a virtual group visit model, and we've been training other primary care providers to expand that offering. And we now have about 12 providers trained, physicians and nurse practitioners. By October, the end of the fiscal year, we're hoping to get to about 20, and by next year, we're hoping to have between 30 and 50. What I'll present here is just some initial findings as far as how our volume has grown in our lifestyle medicine virtual group visit program. Just briefly summarize the positive feedback that we've been getting from patients, and then provide a little bit of information on some of the remote monitoring that we've been incorporating to look at clinical outcomes. So here's a depiction of our monthly volume for our virtual group visits. So on the left, you can see for the fiscal year 21 Q4, which ended about 6 months ago, we were averaging only about 20 patients a month because we were having about 3 or 4 providers who were running group visits. And this is in the primary care model that we've spread. This is separate from a different virtual group visit program that I'm part of at my clinic in Revere. So what I'm talking about here is just the spreading or the scaling of the virtual group visits. We saw a decrease as the holidays took place, but we now have 6 providers up and running, again, outside of our clinic in Revere, which I've presented on elsewhere. And we're really happy to see pretty robust increase in volume up to about 50 patients a month at this point. We've been tracking the patient feedback for all of the participants who have come to the primary care lifestyle medicine VGVs. And just to emphasize that across the board, the feedback has been really, really fantastic. So we ask patients at the end of each group, whether they enjoyed the visit, whether they wanted to attend more visits, whether this was a valuable addition to their primary care, whether it motivated them to take better care of their health, and whether other patients would benefit. And across the board, our average is about 4.9 out of 5 on a Likert scale, which is just really, really exciting to see. And when we look at the open-ended feedback, the open-ended questions, it's amazing just how inspiring the patient experience really has been. One interesting aspect of the group visits that we're starting to solidify now is a hypertension program. So in my clinic in Revere, Massachusetts, we've been building a 4-part hypertension series that includes remote monitoring. I have a paper submitted right now, and this is just some findings that I wanted to share with you. Looking over a year and a half, we had about 45 participants in the program, so different cohorts, about 13 cohorts. And of those patients who had remote monitoring regularly, we looked at how their blood pressure changed before the group visit program and after. So you can see here on the left, the average blood pressure came down about 5 points systolic, 4 points diastolic. In the middle here, you can see a representative patient. So this is just one patient's raw data. And you can see before the VGV series, the blood pressure was pretty stable above the goal of 130/80. During the programming, the blood pressure came down. And then at the end of the program, the blood pressure stabilized, except diastolic, which kept on going down a little bit. We looked at the percentage of patients that were at goal before the group visit programming and after the group visit. And before the group, it was about 40% of patients, and it went up above 60%. So engagement in this program led to about a 50% increase of reaching target goal blood pressure of 130/80 or lower. And actually, this was in the setting of deprescribing. So I was the physician running these groups, and so I deprescribed on patients who were below goal and was actually able to deprescribe on about 45% of the patients in the program. So as we've been scaling the group visit program model, which again, we built and are running in our Revere clinic, but now scaling throughout primary care, and actually starting to now scale into specialties, including nephrology, oncology, and cardiology. We've definitely noticed that there are some challenges. Perhaps the biggest one that we've noticed is just within the large healthcare system of ours. So Massachusetts General Hospital is an enormous academic medical center. The coordination of scaling these programming really takes a lot of effort. So at this point, I now have a quarter of my job dedicated to this. I have a program director who spends half of her time on this. We have a project manager. So I know a lot of you who I've met with in the past and talked with in the past have talked about administrative support. And I can't emphasize enough that to have this run well, which I think we're now starting to run well and scale, starting to run well at scale, really takes a lot of effort and a lot of coordination. I will also mention that we realized we needed dedicated staff members to run the group visits. So we recently hired 2 health and wellness coaches who function as virtual group visit coordinators, recruiting patients, scheduling patients, getting them into the Zoom room, making sure all the technology is working, sending the feedback forms, and following up afterwards. So understanding all the players in the large healthcare system and how to integrate our team has definitely been a challenge, but definitely an exciting opportunity for us to learn how to build and how to grow. And right now, our primary focus is on patient recruitment. So we have a rather simplistic approach to patient recruitment at this point, where we're really focusing on a primary care physician's panel of patients. We do direct outreach to them, but we're starting to move into a more sophisticated patient recruitment stream, having referrals from across the system, in-person recruitment materials such as flyers and posters. We're also starting to use population health approaches to reach out to patients who, for example, aren't at goal for their blood pressure. We're integrating with some of our health equity efforts at MGH. And then this summer, we'll start a real digital marketing campaign, which I think will make a big difference. And then as far as implications for lifestyle medicine practices, the number one point I would just make is that lifestyle medicine virtual group visits are really powerful. Patients love them. The providers that are running them really love them. We're starting to see the health outcome improvements, and our business model has a financial improvement as well. So I think overall, these are really powerful, and we're starting to, I think, have enough experience to say that they are in fact scalable with appropriate resources and support. So thanks very much for your attention. I really appreciate it, but hope to connect with many of you soon. Thanks.